Hey girls, it's time for my week 5 pregnancy vlog. Today I am 5 weeks and 2 days according to my math. When we have the ultrasound, hopefully we'll get a more accurate date. I did ovulate early, so that's kind of, I'm going by ovulation and not by the LMP. So I don't know. The doctor would probably say I'm 4 weeks and 6 days, but I think I'm 5 weeks and 2 days. So, anyways, this week, not a whole lot is happening, but there are a few things, so I'll go over them. I'm still hungry. I sometimes, well, I'm not sleeping very good, and there are two reasons. I wake up every 2 hours like clockwork to pee, and then also sometimes I just wake up and I don't feel very good, and it's because I'm hungry. And so if I've been putting like granola bars on my nightstand, and I'll like wake up and eat one of those, and then I'll feel a lot better. So I'm hungry. I'm even waking up to eat, and that is annoying. But what are you gonna do? It's better than feeling sick all the time. And as long as I'm eating when I feel hungry, everything like I feel okay. So that's good. I have a little list over here. That's what I'm looking at. My tastes are still changing. I'll think I am hungry for something and I'll eat it and I don't like it. And that's kind of annoying because you take time to cook something and then you eat it and you don't like it. So I don't know what is up. When I was pregnant with Connor, I only had like one or two things that tasted different that I didn't like anymore. And then this time, I don't know. I just almost everything I eat tastes different. It's strange. I'm still breastfeeding Connor. He's going about 4 or 5 days in between nursings now, so it's, stretching out even further. And I did notice this week my milk is changing. It's turning, mature milk is white and it's thin, and my milk is turning yellow and it's thicker now, which is more towards what colostrum is like. Colostrum is pretty thick and a yellowish tint, and then the transitional milk between colostrum and mature milk is like a little bit thinner, it's sticky, and it's yellow. And that's what my milk is like right now. Connor doesn't act any differently when he nurses. He doesn't pull away, like he doesn't act like it tastes different or funny or anything. But a side effect of colostrum is a laxative. Colostrum helps when a baby is born. It helps clean all the meconium out. So that's why it has a laxative effect, and it's having that effect on Connor. Every time he nurses, he poops like, I don't know, 4 or 5, 6 times that day. So, and he got a diaper rash the last time he nursed because he was pooping so frequently. So we're hoping that the weaning continues to space out until he just doesn't ask anymore, because I'm sure he doesn't like having diaper rash or having laxative. So I've been feeling some like tugging and twinging and pulling in the uterus. Almost what I would say are like around ligament tuggings. I notice them the most when I roll over in bed, and I know it's way early to feel things like that, but it's a second pregnancy, and I don't know like what the rules are, but I'm just telling you what I feel. Hopefully, it's not like a sign of something ectopic or anything like that, but it's mostly on my right side, which makes me feel better because round ligament pain is mostly felt on the right side, so that's good. But it's like when I move too quick or I roll over in bed, I get like, I know what round ligament pain feels like. I've had it before. It's just like, it's uncomfortable. It's very uncomfortable, but it doesn't last long. And if you lay still or change positions or kind of stretch a different way, that goes away. And that's what's happening. It's not like a persistent pain at all. Okay, so the past 3 days, I'm still charting, and my temp is dropping. It's down 0.3 to 0.5 of a degree, and that worries me. The only thing I can attribute to it is it was like in the 70s here, like, I don't know, a week ago. Yeah, like a week ago. And then the past couple days, it's been snowing, just dusting, but still snowing, and in the 20s. And we had like the windows open before, and it was really nice. And now we're turning the heat back on. And also, I was sleeping with an electric blanket. Since I found out I'm pregnant, I still slept with the blanket, but I didn't turn it on for very long or very high. And then, like, about 4 nights ago, I put it away because I was like, because it got cold again and I wanted to turn it on, but I don't want to, like, cook myself when I'm sleeping. So I put it away. So those two things could be a reason that the temperature is going down. I don't know. Because I still feel warm, like, during the day. Like, I get that feeling, like, I feel really warm from the inside. I don't know if you're pregnant, you know what I'm talking about, probably. You just feel warmer than you normally do. I still feel that way, just not when I wake up. Okay, so I had a really tough work at night on Friday night. I had a difficult patient to work with, and I was by myself, and I had to lean over a bed for like a good 45 minutes. And leaning for 45 minutes, like forwards and balancing yourself, is difficult, anyways. But my back and my my hips, were killing me when I got off work. And my legs were swollen. I don't know, but it was crazy. I seriously felt like I was like 8 months pregnant with how achy and swollen I was when I got off work. And I worked 12-hour shifts, so it was a long night. It was a lot of work, and yeah, I don't know where that came from, but that worried me a little bit. Like, if I feel like this now. But then I worked on Saturday night and Sunday night, and I felt fine. So yeah, I think it was just the stress of that night and everything that was going on. Let's see, I've been thirsty, very thirsty. I took another HPT on 18 DPO, and the control line is lighter than the test line now. So my test line is officially darker than the control line. So that's good. I have an ultrasound on Wednesday, so I'm excited about that. And I'll be 5 weeks and 4 days according to my math. And I'll be 5 weeks in 1 day, I think, or just 5 weeks, according to my LMP. So I don't know if we'll see a heartbeat. It's probably a little bit too early, but hopefully we see a thickening on the yolk sac and everything like that. Hopefully we can see the pregnancy is in the uterus. Hopefully they can tell me if the lining of the uterus is good, if it's thick enough, if it's looking like it can sustain a pregnancy. So I'm excited about it, and I'm nervous and terrified at the same time. But who doesn't want to see their little baby? So it still puts a smile on my face, even though I'm terrified at the same time. So tonight we went shopping at Babies R Us, and we're having a tough time deciding what we want to do for sleeping situations once the new baby is here. My son will be 26 to 27 months old, just depending on when the baby gets here. And he is a troublemaker, and he gets into everything. So the thought of putting him in a toddler bed terrifies us. The thought of dealing with that and having a newborn terrifies us. But we don't want to push him into a toddler bed too early, just so we can have his crib. And we have a twin-size day bed, and it has like rails on the head and the foot and the back. And we're going to get one of those mesh things for the side and put it under the mattress so it comes up. So he should not be able to fall out. And that's what we're thinking we're going to try, is just to give him the day bed that we have that's a twin size, and see how he does in that. And then if he does okay, we'll give the new baby his crib. If he doesn't do okay, we'll probably buy, the crib we have right now is not a convertible crib. So we would probably buy a convertible crib and give that to Connor, and then Connor's crib to the new baby. That way we can turn it into a bed when he's ready, or maybe just a toddler bed. I don't know. So, any of you that have about 2 years apart, do you have two cribs? What age did you start the toddler bed? How soon before the baby was here did you do the toddler bed? Because we're trying to think of our options right now. We don't co-sleep because we work the night shift and we sleep during the day. It's really not possible for us to co-sleep. The baby, like when I'm on maternity leave, I will be sleeping at night. We did co-sleep with my son a little bit. Like he would wind up with us in bed. Some nights he would wind up within arm's reach some nights. And then towards the end of my maternity leave, we started moving his little bedside sleeper closer and closer to his room. Then we put it in his room, and then he did fine with that. And then we moved him from his little sleeper into his crib, and he did fine. So, when I'm on maternity leave, the baby will be in our room, which should be hopefully for 3 months. So we have a little bit of time to figure it out, but let me know what you guys do in that situation, because that's something that we're thinking about. So I haven't weighed myself today, and I don't think I'm going to weigh myself every vlog. If there's like a noticeable difference in weight, I'll probably let you know about it. I think I'll touch on that probably every time I have an OB appointment. And speaking of OB appointments, that whenever my first official one will be depending on the results of the ultrasound and how far along they say I am and things like that. So, and I'll measure the belly. I'm not going to show it to you. Like, I'm not going to lift my shirt up every week. I just wanted you guys to see where we started the one. Okay, so we're pretty much about the same. It's right over my belly button here, so no growth yet. I think that's all for this week. Even though I know I'm already into the next week, I work on the weekends. There's no way I'm getting a vlog up on the weekends. I work 12-hour shifts. It's an hour and a half with drive time, so 13 and a half hours I'm away. I want to spend time with my son. I want to sleep. I want to eat. I want to shower. So there's just not time during the weekends to do vlogs. So my guess is they'll be up on Mondays. It might be closer to like Tuesday because I might be editing it at like midnight or something. I don't know. But I'll film them on Mondays and then I'll upload them as soon as I'm done editing. So that's how that will work. Thank you to all my new subscribers. And thank you for heading over to Facebook and following me, because a lot of you have found me over there. So I do update on there all the time. So that's a way to kind of see what's going on in between my vlogs. So it's Abby space D-I-G, Abby Dig on Facebook. You can find me that way. And I'm looking at my list because I really feel like I'm forgetting some things, and I probably am. Oh, one thing, my face is breaking out. That I think is what was the obvious thing that I wanted to tell you that I forgot to say earlier. That's the other thing I'm pretty sure that I was forgetting because I didn't write that down. Yeah, but besides that, I feel pretty good. Besides being tired and a little nauseous, but I'm not complaining because that is expected and that is a sign of everything being healthy. And yeah, so some prayers and thoughts for Wednesday, just so we can see a baby and just get a little reassured about everything would be appreciated. But thanks for watching, guys, and I'll probably update after my ultrasound. I'll probably throw a quick vlog in here, and then week 6 will be up next Monday. So thanks for watching, guys. Bye.